Jai Hind and good morning, respected Principal Sir, esteemed Head of the Departments, faculty members, and dear students. Swami Vivekanand Subharti University is a center of holistic development with the four foundation pillars of Siksha, Seva, Sanskar, Evam Rashtrita. Subharti is a manifestation of ideas of Dr. Atul Krishna Sir and Sangmata, late Dr. Mukti Bhatnagar Ma'am. Dr. Atul Krishna Sir, the founder of Subharti University, is a visionary educationist and philanthropist. The institution was established with the sole mission of making quality education accessible to all society, irrespective of gender, caste, creed, or religion. The university is progressing under the able leadership and guidance of Honorable Vice Chancellor Professor Dr. P.K. Sharma Sir, young and dynamic CEO Professor Dr. Shailraj Ma'am, and visionary administrator Professor Dr. Krishnamurthy Sir. Under the dynamic leadership of Dr. Nikhil Srivastava Sir, Principal and Dean of Subharti Dental College, the institution has achieved significant milestone in education, research, and patient care. Keeping with the tradition of imparting knowledge, the Department of Oral and Maxillofacial Pathology, Subharti Dental College, feels privileged to present Subharti Alumni Lecture Series, celebrating the achievements of distinguished alumni. I feel honored to introduce our esteemed guest speaker of the day, Dr. Chitrapriya Saxena Ma'am. She is an alumnus of Subharti Dental College, having completed her BDS in 2012 and MDS in Oral and Maxillofacial Pathology in 2015. She has several national and international publications to her credit, including research in oral cancer, dysplasia, angiogenesis, and immunohistochemistry. She has also co-authored a book titled Antioxidants in Health and Disease. She has actively participated in multiple national conferences and CDE programs. She has received academic recognition, including a Certificate of Merit and a Best Scientific Paper Award. Dr. Chitrapriya Saxena Ma'am has over 6 years of experience as a senior resident of LLRM Medical College, Meerut, and is currently working as an assistant professor at Kalka Dental College, Meerut, along with clinical practice as a senior consultant. She is also associated as a scientific medical editor for a medical journal. It is my proud privilege to invite a respected principal and dean, Dr. Nikhil Srivastava sir, to kindly address the gathering and share his word of wisdoms with the audience.
Thank you, Ekta. Jai Hind, a very good morning to all presentees who are here, particularly Chitrapriya, our own alumnus, and now she has come as the speaker. Uh, Chitrapriya, welcome to Subharti Alumni Lecture Series.
Thank you, sir. Thank you so much.
Yes, we have started this, I think, 3 years back. The idea was to engage our own alumnus who, after passing out, they just go and they just forget the college. They might be remembering, but they do not come and participate in college activities. That is why we say that you have forgotten your own college. So that was the whole idea. And second important objective of this SALS was that the students should know that the old Subhartians who passed out from here are exceedingly doing well in their own field. And that is why we started this, and we are really have privileged to have you here. And you chosen a very good topic, the hepatitis, the dentist perspective. We all know that hepatitis is a very risky disease as far as dentists are concerned, and also the patients. And we are at more risk because we commonly deal with saliva and blood. So we have to be cautious, and that is why we should have adequate knowledge about the hepatitis. And I'm sure that whatever you are going to delivering will be of great benefit to all the students who are participating and the faculty members. And I'm sorry that I will not be here till the end because I have a lecture at 9:10. So if I can join before your lecture finishes, I will certainly join and contribute something, at the end of your lecture. But otherwise, congratulations and all the very best for your lecture. Thank you.
Thank you. Thank you.
Thank you so much, sir. Over to you, ma'am.
Okay, thank you. Thank you so much, Ekta. A very warm greetings to all. And on very onset, I would like to express my heartfelt gratitude to the management of the college, respected Vice Chancellor Sir, CEO Ma'am, Principal Nikhil Sir, and my guide, my mentor, head of the department, Dr. Vijay Vadvan sir, for inviting me to address you all today at Subharti Alumni Series. And I'm extremely privileged and honored to be the alumni of this esteemed college. This college has always been not been just a part of my studies, but the place where I have placed my foundation for my professional journey. And the postgraduate years under Vadvan sir have been extremely transformative for my personal and professional journey. And again, once again, a very heartfelt thank you. Now, coming to the today's topic, we will starting. Uh, we have here very commonly about this, but this topic itself is an ocean in itself. I have tried to cover the informative part of this, the fundamentals, and the, that they can be applied to your knowledge and day-to-day clinical practice. So, starting understanding the hepatitis from a dentist point of view, the first question, why we need to know this, not just as a professional person, but as a normal human being, why is hepatitis important to be known? Now, this condition is very crucial because it transferred to the liver cirrhosis, a chronic condition that further transferred to the carcinoma of the liver, which is dangerous for the human life. And if we study the epidemiology of this disease, the data published in her Global Hepatitis Report 2024, from the data of 2022, it's shown that there are 1.3 million deaths and newly 2.2 infected cases per year. In India, it is observed that hepatitis B and C combinedly can kill around 1.23 people in reported 2022. New cases of hepatitis B were 50,000 and 1.4 lakh for hepatitis C. To increase the awareness related to this disease, the WHO has observed 28 July as an important day, so we can address the general population for this dangerous disease. Basically, it's an inflammation of the liver and very importantly focused by the WHO in the present scenario. Now, coming to its terminology, the hepra means liver and itis means inflammation. Now, this inflammation can be caused by various factors. Etiology can be viral, alcohol, and drug induced, autoimmune condition, hematochromatosis, etc. Basically, it's an inflammation, but in general terms, when we commonly speak about it, we commonly relate it to the viral hepatitis. Its span can be acute, that it can be observed within 6 months of disease, or chronic condition that is occurring in more than 6 months. Basically, this RNA containing viruses are spreading, like hepatitis A and E are basically RNA virus which enter through the fecal-oral route. Virus hepatitis B and C, they are bloodborne viruses, transforming viruses, and hepatitis B is the only virus which is a DNA virus, and hepatitis C and D again are the RNA viruses. So the route of transmission is very important and play a crucial role in this infectious condition. Hepatitis A and E again are spreading through the fecal-oral route. They enter the intestine and transfer to the liver. In case of hepatitis B and C, they enter the bloodstream and then transfer to the liver. Where in case of hepatitis D, it requires the co-infection with hepatitis B. In dentistry, as we are very close contact with salivas, with secretions, various secretions, and blood, because our day-to-day surgical practice, hepatitis B and C are very frequently observed in dentistry. So the spreading is through the contamination of the food, water. In case of blood infective condition like blood transfusion for newly born child from her mother, or we can have the multi pricking needles infected needles, infected sharp instruments, etc. Now, coming to its signs and symptoms, as we have observed that hepatitis A and E are spreading through the intestinal route, the most common symptom which is seen in acute phase are vomiting, abdominal pain, severe fever, fatigue, etc. In case of hepatitis B and C, as these conditions act as acute, then progress to the chronic condition, we observe the jaundice, mild fever, joints pain, then loss of appetite, fatigue. Then, when it exceeding towards the chronic situation, it lead to the cirrhosis, ascites, and hepatic encephalopathy, which affect the multi organs. So the symptoms start appearing organ wise. It's a high burden condition in India because there frequently observe unsafe injection practice, inadequate sterilization, and limited awareness about this topic. Dental settings has been reported in last literature and publication that they play a major role in to prevent this disease in the dentist as well as in the general population. So, who are at risk? General barbers, beauticians, sanitation workers, blood bank persons are at risk, but we as a dentist and our associated professions are more at risk because we are frequently in contact with saliva, the GCF fluid, the blood of the patient. So, as a dentist, we are not only at a professional level, but on the society level, also play a major role because the awareness related to this disease, vaccination, its treatment, how to prevent this on the journal level, also very important to give to the patient how we can prevent this. In on professional level, there are various steps that we have to follow to prevent the spread of these disease, like early detection of these cases when patients are unknown about their condition in the initial phase. We as a professional person can easily check the loopholes going in the bodies, and the patient, how to handle the patient when we introduce this condition to the patient, how we have to counsel the patient, and how we ask them to have a normal life when we have seen that they have this important infectious condition which can spread in their family also. So when a patient report to you or come to for a general dental procedure, but in case they have told you that they are known case of hepatitis, what first step we have to take? We have to consult the physician of the patient to know the status of the hepatitis, to know the type of the hepatitis, whether it was B, whether it was A, whether it was D, which kind of hepatitis the patient has suffered from. Presently, what is the state of the patient? Has it been the acute phase or a very chronic phase, or a patient is a carrier of the hepatitis? Duration, the how much duration the patient has undergone for the treatment, and how duration of the disease also is very important. Then we have to go for the investigation of HBsAg and anti-HBs HBs. Now, what are HBsAg? These are the antigen which can be detecting in the patient blood. Now, they depict the acute phase. The patient is presently in the acute phase of the disease if this test come positive. In case of anti-HBs, these are the antibodies. Means if this test come positive, the patient has developed already antibodies towards this disease. Patient with medical conditions like lepromatous leprosy, HIV, lymphomas, Down syndrome, patient receiving immunosuppressant drugs, drug abusers, we can suspect these cases that they can have the co-infection with HCV. So the medical history play a very important role during the treatment procedures. The unknown cases. Suppose the unknown case come with an oral manifestation. Oral manifestation can be related to disease. Now, why these manifestations we should relate to this disease? Because liver is affecting. The liver is undergoing stress and unbalanced. So what condition we can see? We can see the atrophic tongue, glossitis, gingivitis, the bleeding tendency develop because the poor working efficiency of the liver. So they can appear as a petechiae in the oral cavity. If the acute condition or jaundice is developing, we can see the mucous membrane jaundice, which can be easily yellowish discoloration of the mucous membrane. You can distinct easily in the oral cavity. Secondly, the cyalolithis, the Sjogren syndrome. As we have seen that autoimmune conditions or this hepatitis, what they cause the imbalance in the immunity of the body. So they can react towards the salivary tissue, which lead to the development of Sjogren syndrome, cyalolithis. It has been observed in the past literature that lichen planus has been seen in many cases of hepatitis C. So we have to very carefully examine the patient and relate this to any medical condition. Now, risk factors which are important to be taken care. As oral and nasal secretions, they act as a vector for these viruses in when we start with the treatment. Now, needle prick injury, sharp objects, which can give a we can touch the mucous membrane with these object, and they can get transferred to that. Now, gingival sulcus, we have observed the hepatitis B virus load is very commonly reported in gingival sulcus also. So the aerosol producing instruments, procedures like ultrasonic scanning and endodontic treatment should be taken care of that time. Now, the guidelines says that we should give a proper mouthwash before the procedure, and a high volume suction evacuators should be used during these procedure. We should try to limit the treatment to the urgent or the emergency cases, so they can be treated easily. Coming to the standard precaution, now these precaution is not to be practiced during this HIV hepatitis patient, but we should adapt them to regular practicing as a regular practicing procedure, because it's not only prevent us with hepatitis, HIV, severe infection, but normal infection contaminations also. Proper hand hygiene practice, use of personal protective equipments, cuff etiquettes, sharp safety practice, safe needle practice, sterilization of the instrument, and disinfection of the surrounding environment. Hand hygiene practice, always wash your hands with soap and water when you see your hands are visibly soiled. Use the alcohol-based scrub intermittently during the procedures or during the examination of the patient. Please don't touch any instrument barehanded by you or by your assistant. We should avoid these things, and we should wash hand before putting the gloves and after removing the gloves. WHO has given a guideline for the proper washing, surgical scrubbing, hand washing before the procedures, and we should follow them. Now, personal protective equipments we need to wear the puncture-proof gloves, mask, eye shield, hair cap, shoe gloves, etc., to give the complete protection from the aerosols also. Now, dental health care person should be trained how to remove your PPE protection kit, how to put them, how to remove them. The proper training should be given. There should be not repeated touching with the infected hand on your any part of your body or any kit part of the kit that we are wearing, you should be keep repeatedly sanitizing your hand in between while removing the kit, while doffing of the kit also. It is important. And it should be left where that procedure has been done. You should not roam around by putting all your gloves and masks, everything in your clinic. That should be restricted to the surgical area only. No, cough etiquette it is basically for the patient. If patient is coming with the acute phase of infection, then they should be advised to put the proper mouth mask, sit separately in the waiting areas. A proper separate area for performing the hand hygiene should be given to the patient. The disposable tissue, providing the disposable tissue to the patient, and making a proper distance between the patients and yourself is important. In case of safety, the needle, the scalpels which we use, there are two kind of controls that we follow is engineering control and work practice. Now, engineering control are the instruments which are self-adjusting to protect us from repeated pricking or any accidental cut. Now, these include the self-sheathing anesthetic needles, safety scalpels, and needle-less IV ports. Work practice control means that once-handed scoop technique for recapping between the use and before disposing the used needles. Do not bend or break the needle during the procedure, and do not pass this bare needle to your attendant or throwing it barely. This is not acceptable. Now remove the buzz before disassembling the handpiece. To retract the cheek or the tissue during the suturing procedure, we should use the assistant instruments, not by the finger or thumb. For safe injection practice, CDC dental guidelines are given in 2003. They say kindly upload the vial in a clean area. Do not use more than one syringe in a same patient or in different patient, even if they are insulin needles or the pre-filled needles. Secondly, if we have to fill the we have to fill the injection multiple times from a single vial, the new needle should always be introduced at the same time. We should not continue using the same needle of the patient if from the common vial also. It has been observed that hepatitis virus can stay alive for the 5 days on a surface, and in case of hepatitis B, it can exceed to 1 week. So the disinfection of the surfaces in the operating area is very important. According to CDC, it is said that use bleach with water in 1:10 ratio, or 2% activated glutenaldehyde will be sufficient to kill these viruses. Non-sterilizable items or non-reusable items should be thrown in a puncture-proof bag and should be labeled properly before disposing of. And we should follow a biohazard waste guideline for the disposing of these materials. There are various methods of sterilization. I won't go in deep because it's a vast topic in itself, but basic autoclaving, dry heat sterilization, chemical sterilization, they all are used to prevent the spread of viral infections. Now coming to the management of these patients. So the basic thing that we should remember when any patient with liver disease, most commonly patient with chronic liver hepatitis also came to us. So liver disease, it's a liver disease. So we should focus on the liver disease, side of the liver disease. Now these patients have the tendency to bleed. They have a bleeding tendency. So their coagulation profile, hemostasis profile should be tested before any surgical procedure. Their INR ratios should be properly evaluated before any surgical procedure because they can bleed severely during the surgical procedures. There are various drugs which are commonly used in dental practice day to day, but they affect the liver, they can get affected by the liver metabolism. So these include in local anesthesia, lidocaine, mepivacaine, etc. In analgesic, aspirin, ibuprofen should not be given to these patients. Sedatives like diazepam, barbiturates, antibiotic like tetracycline, metronidazole, which we frequently prescribe to patients, should be uh, uh, taking care of this while prescribing them to the patient. The diagnosis of the patient should be evaluated before the procedure. Now, this have two evaluation procedure, that HBS AG antigen and anti-HBS. This is antibody. Then these titer can be measured by the ELISA test. While if we want to know the infectivity of the patient, we should go for the HCV RNA. RNA and DNA can be detected by the PTC. RT-PCR technology, and antigen and antibody testing should be done by the ELISA. Coming to the post-exposure prophylaxis, what if the person get exposed to any kind of secretion or the blood of the infected case or an unknown case also? So according to ADA and OSHA, they have developed an employer obligation after exposure incidents. What they do, they have trained the professional licensed profession where you can report to that person who is already trained to give you a proper evaluation of the condition. They will keep the track on your symptoms. They will keep the track. They will recall you again and again. They will again check your status after the exposure. Being it you, being your dental assistant, any dental profession should report to these licensed individuals. So first step, what we should do, we should treat the site as an exposure site. We should immediately wash it, use soap and water. In case of mucous membrane exposure, use water. In case of splashes or splattering of the saliva, proper washing should be with normal distilled water should be done. In case of eye contact, proper distilled water washing, then normal saline can be used to give some such splashes of normal saline can be done on the eye also. Now, squeezing of the pricking side or cut side should be avoided because it introduce more virus in the wound. Secondly, report them with proper details of time and date, so it can be documented and recalled after a few weeks or months according to the protocol which is set up. Secondly, the procedure detail, what procedure has introduced this in our body, like it was just journal scaling or endodontic procedure, or it was a major surgery, etc. Now, exposure detail, like which body site was exposed, what kind of fluid enter, like blood or saliva, because they are main source of entrance of the viral infection. Now, if the patient if the source, the person, the patient, if the source is we have to evaluate the source also. So the testing of the patient should be done for the antigen and the antibody both. The viral load is not recommended to be checked during the journal procedures, routine control procedures. It should be only done when we already know that it's an acute case or going through an acute phase of the disease. That time only the viral load should be considered. Otherwise, we can go for the journal checking of the antigen and antibody. Now, specific prophylaxis should be given. To the infected, if the patient is there, we should follow the proper specific prophylaxis after the antiviral treatment should be start giving in case the patient is already a known case. In case of control monitoring, now what is this control monitoring? Antibodies develop after few months of vaccination. So if you are going for the evaluation of antigen and antibody, please take some time. If we give the immunoglobulin treatment initially, it should not be evaluated. The antibody should not be evaluated because it will give a false positive result. So we should wait for at least 1 to 2 months after the vaccination to check the antibody status. It has been seen that if the source is coming RNA negative, then the risk of developing the infection is 1.8 and 3.1%. But if they are polymerase chain reaction positive, then the risk increased to the 10%. So the baseline 3 months and at 6 months, the repeat test should be done. We should also keep repeating the test for the liver function test at 2 and 3 and 6 months to check the status of the liver. And journal sign and symptoms should also be kept in observation. If source is already positive for the hepatitis B, then it is recommended to give the hepatitis B immune globulin injections. These are the shots which are available in pharmacy, and the vaccination should be started initially. We should also go, if we check the antibody levels and they found to be less than 10 microliter per ml, then the immunoglobulin shot should be started within 48 to 72 hours of the exposure. Now these are the immunoglobulin shot. What are they? They are basically the concentrated immunoglobulins which are extracted from already infected individual, and they act as a passive immunity at the site where the exposure has been done. Like if you have a cut or a prick at particular place and a blood comes in a contact, then the injection should be given at that sites. So the initial immunity to the viruses towards the viruses start developing there. Presently, the treatment regime for the hepatitis, that in case of A and B, which are the acute cases which develop between 8 to 10 days of infection, supportive care has given good results. In case of B and C, starts with immunoglobulin shots and the antiviral drugs, directly acting antiviral drugs. It has been observed that 90% of the cases got cured with these. Secondly, vaccination play a major role in prevention of this disease. We have vaccination for A, B, D, and E, but not for C. So there's a proper protocol for the vaccination. There are 3 doses for initial baseline, then first month followed by 6 months, and it has been observed that this immunity lasts for 10 to 15 years. So we should go for a booster dose after 10 to 15 years. So with this, I want to give you a take-home message that it's a publicly alerting condition. We as a dentist have to be very careful regarding our day-to-day practice, because not only for us, for the patient also who are coming to us, we should not infect us, not the society, and keep ourselves updated regarding this condition. Thank you. Thank you so much for hearing, and wish you all a very happy new year in advance. Thank you.
Thank you, ma'am. It was a very informative lecture, and I'm sure everybody has benefited from it. May I now request a professor and HOD, Dr. Vijay Vadvan, sir, to kindly felicitate a distinguished guest speaker, Dr. Chitrapriya Saxena, ma'am.
Thank you so much, Chitrapriya, for a wonderful, crisp lecture, to the point, and covering everything that is necessary for and undergraduate, for the postgraduates. And this is like, I think I have not made a mistake by choosing one of our really wonderful alumni for delivering this particular lecture. No one
Thank
could
you.
have done a better justice to this particular topic than you itself. And on behalf of the department and our dental college, please accept this particular certificate. We'll be mailing you the certificate also, and we'll be sending you the hard copy of the certificate as well. Thank you
Thank
so
you.
much, and it was wonderful listening to you. And all the best, and God bless you.
Thank
Thank
you.
you.
Thank you.
On behalf of Department of Oral and Maxillofacial Pathology, Subharti Dental College, I extend my sincere gratitude to the management of Swami Vivekanand Subharti University, Honorable Vice Chancellor Dr. P.K. Sharma Sir, and Principal and Dean Dr. Nikhil Srivastav Sir for their constant guidance and support. A special thanks to our distinguished guest speaker, Dr. Chitrapriya Saxena ma'am, for delivering such an insightful lecture. We also appreciate the efforts of IT department for their technical assistance, and a heartfelt thanks to the faculty members, colleagues, students whose presence and participation made this session meaningful. Thank you everyone.